Hi there, Dr. Mandy here. I'm gonna talk about something that's kind of a hot topic in audiology and in the hearing aid industry, and that is over-the-counter hearing aids. So a few years ago, President Trump signed the over-the-counter hearing aid bill, and what that is it gives patients more access to hearing aids. For example, those that live in rural areas that don't have access to health care, or those that are just simply can't afford hearing aids. This is what this bill is for. So the FDA has until 2020 to come up with their guidelines. And I do know that there are some hearing aids that are being advertised in the market over online about they're one of the first FDA approved. That is not true. There are no FDA approved devices right now because they still are coming up with their regulations, and those are due in 2020. The other thing is these over-the-counter hearing aids are going to be for those that have perceived mild to moderate hearing losses. What does that mean? That means you haven't really had a hearing test. You might perceive yourself as having a certain degree of hearing loss, and maybe you don't, but you don't know that until you have a hearing test. And there are certain websites that claim to be able to give you a hearing test over the internet, but that usually is not very accurate. The implications about these having access to self-treat and self-diagnose yourself, that there's a lot of underlying health issues that can go along with hearing loss, especially if you have hearing loss in one ear. Those kind of things you might need medical intervention. So to self-diagnose, try to self-treat something, it's always good to get to a healthcare provider and know what the cause of your hearing loss is, because you could miss something that could be the result of something else serious. Another thing is sometimes these devices that are sold or online, you don't know if they were used. So if you are looking at purchasing something and you think it's a great deal, I'm saving myself $1,200 or whatever, know where to get the information, know where to access the manufacturer, know what your serial numbers are, and just know what you're buying. The other thing is when you are trying to program these hearing aids to a perceived hearing loss, you are putting yourself at risk for improperly treating, because you might be causing more hearing loss. You might not have as much hearing loss as you think, or your first reaction to the amplifiers is these hearing aids don't help. Well, you don't really know. In the majority of the cases, the hearing aids do help, but you have to have the proper techniques and the professionalism of somebody to program these hearing aids. Make sure that you get those real-ear measurements done at fittings, and making sure you're getting the proper amount of volume in each frequency of where your hearing loss is. And if you're not sure what real-ear measurements are, if you go back to some of my videos, I have a YouTube channel and Facebook, I do talk about real-ear measurements. So this leads right back to the hearing aid industry. There is going to be more access, and if you are exploring the idea of the fact that you might have a hearing loss and that you are, you're budget conscious, everybody is, and you're just looking into things, it's always good to get all the information. You can certainly call my office if you have any questions. My number is 605-306-3050. I would be glad to answer any questions for you. And sometimes when you are doing your research, you might find out that you might be saving money, but in the long run, after you have to get some extra help and make sure that everything's set right, you might even be spending just as much money, if not more, than if you'd just gone right to an audiologist at the get-go. So I am here. I am happy to help with any information. So if you need anything, just let me know. Thanks.